Canada is currently facing an opioid crisis, one that has killed over 30,000 people since 2016 and is continuing to kill people today. The epicenter of this crisis is British Columbia, which saw over 1,000 drug-related deaths in the first 5 months of this year alone. Illegal drugs are killing so many people in BC that drug toxicity is now the leading cause of death between people aged 10 and 59. More than homicides, suicides, car accidents, and natural diseases combined. The BC NDP and federal Liberals have responded to this crisis with a harm reduction and safe supply agenda. The latter consists of the decriminalization of hard drugs in the province, giving addicts a safer supply of drugs, and having injection sites where people can safely consume drugs. While this so-called harm reduction agenda is supported by politicians and activists, the opinions of several experts, as well as the lived experience of people who dealt with safe supply, are painting a different picture. One that shows that Canada's safe supply agenda has been a disaster. One of the people bringing light to this issue is National Post columnist Adam Zivo, who has written several pieces about safe supplies and its harms. He joins me today to discuss this issue. In addition to his journalism on safe supply, Zivo is known for his coverage of the war in Ukraine. He even spent some time in Ukraine during the war, as well as his coverage of various LGBTQ issues. Adam, thank you so much for joining me.
Thank you for having me.
So we often hear in the media the terms harm reduction and safe supply, but I'm not sure if Canadians, or a good part of Canadians, actually know what these terms entail. So how about we start with maybe you explaining what do we mean by harm reduction and safe supply in a Canadian context?
So harm reduction refers to a broad umbrella of interventions which are meant to reduce the harms that drug users experience while they're using. So some examples of harm reduction include needle exchanges, safer injection sites, and safer supply. So harm reduction is considered to be one of the main key pillars of addressing any drug crisis. Now, within this umbrella, you have, safer supply, and safer supply is this idea that we can reduce overdoses and deaths by providing drug users with pharmaceutical alternatives to potentially tainted illicit substances. So in Canada, that means giving people hydromorphone, which is a drug that is as potent as heroin, to try to dissuade people from using illegal opioids, predominantly fentanyl. I do want to flag that there are multiple models of safer supply that exists in the world. The one that exists in Canada is unique and is uniquely irresponsible.
Why is it uniquely irresponsible?
Well, if you look at safer supply in Switzerland, which is done fairly well, there's a high barrier to access, meaning that it's not as if anyone can come off the street and get on the program. And on top of that, consumption of the drug is typically supervised. In contrast, in Canada, we really emphasize low barriers to access. So anyone can walk in and say, I want to be on safer supply. And as long as they find some trace of an opioid in your blood, they will give you it. As long as you say that you are worried about overdosing on fentanyl, there's no verification of the truth of what you say, aside from that simple blood test. And more importantly, consumption is not supervised. So we hand out large amounts of hydromorphone, which I do want to stress again is as powerful as heroin. And we don't really confirm whether people consume their doses, so they can take it home. Now, why this is a problem? Well, hydromorphone, as powerful as it is only 1/10 as strong as fentanyl. Its strength compared to fentanyl is like holding a candle against the sun. And people who are on fentanyl do not get high on hydromorphone, so they don't actually like the drug. It doesn't give them what they're looking for. So they sell the hydromorphone on the streets to purchase harder drugs, predominantly illicit fentanyl.
Right, and when they sell hydromorphone on the street, it ends up in the community, and Uh, it goes into schools, for example. What impacts has this drug that is marketed as a safer supply drug had on the broader community, and particularly teenagers?
Well, so as you mentioned, it does flood into communities. And when you have a flood of supply, that causes prices to go down. I've spoken with addiction physicians in about 5 or 6 different cities, and they've independently told me, no correspondence between them, that in their communities, since Safer Supply was launched, that the price of hydromorphone, the street price, has gone down by between 70 and 95%. And crucially, these price drops seem to be correlated to proximity to Safer Supply dispensaries. So, for example, in downtown Vancouver and the downtown east side, where there's a whole bunch of these, pharmacies that dispense Safer Supply, you can buy a 8 milligram tablet of hydromorphone for between $1 to $2. Whereas if you go slightly outside of Vancouver and you go into the suburbs, tablets begin to cost around $5 to $10. Now, what happens is that people often buy these drugs in these hotspots and then sell them in markets where they're more valuable. And they tend to sell these drugs to opioid naive users for whom the drug produces a high, right? You're not going to sell hydromorphone to fentanyl users because they don't want it. And if you're selling to opioid naive users, that means you disproportionately sell to younger people and to people who are in recovery. Now, younger people are attracted to the drug for a variety of reasons. First of all, it's cheap, right? And for someone who is young, that matters a lot, especially if you're from a lower socioeconomic bracket. And secondly, they don't understand the risks of hydromorphone. It's not stigmatized in the same way that heroin is. And additionally, it is marketed as safe and is technically prescribed from a doctor, and it comes from a pharmacy. So they're much more willing to experiment with it versus other drugs, even though hydromorphone is extremely dangerous for them.
So essentially what you're saying is that the safer supply agenda has kind of created a new drug deal and a new kind of generation of drug addicts.
It has. The problem, though, is that the government seems woefully uninterested in measuring this impact. And they seem to be doing their best to try to minimize this effect. So there's not a lot of data that has been collected on this. And what happens is that, for example, the BC government has often misrepresented data to say that this problem doesn't exist. Now, one thing I want to note is that kids who go on hydromorphone, they become addicted, they often then graduate to using fentanyl because you develop a tolerance over time. So you need harder substances in larger amounts to get the same high. And it's not the hydromorphone that tends to kill people. It's the fentanyl that they use after developing the hydromorphone addiction. I currently writing a story that, spotlights one such youth in the Vancouver area who had that exact problem. Now, the BC government, in response to my reporting, has really emphasized the fact that they have not seen a rise in hydromorphone-related deaths in the province. And they say that, okay, based on that, we can see that there is no problem with safer supply. But that's misleading because, of course, you're not going to see that rise in deaths if the hypothesis is that fentanyl kills. Now, I'll just finish my monologue with one last thing. Sorry for talking so much.
No, go ahead.
So the BC government released a toxicology report last month that included for the first time data on youth drug deaths. And what they tried to bury in the report, but what myself and physicians were able to discover is that, okay, the data was from 2017 to 2022. From 2017 to 2019, 0% of youth drug deaths had any hydromorphone involved. Then safer supply is expanded in 2020, and that number increases to 5%. Then 2021, I believe it's 8 or 9%. And then last year in 2022, hydromorphone was found in 22% of youth drug deaths. So that's a sudden and significant spike, which seems to indicate that there's a problem.
Drug injection sites have been a kind of a staple of the harm reduction model, and the first one in North America opened in Vancouver. Since the election of Justin Trudeau, there have been many more that have opened across the country, including where I live in Ottawa, where you live in Toronto. What are your thoughts on these sites? Because the people who support them say they offer a safe and clean place for users to inject themselves. There are critics that say that they enable drug use. Should these drug injection sites continue to operate, or should they be shut down?
Well, I really want to emphasize that safer injection sites are a totally different intervention from safe supply. So while I can speak quite knowledgeably about safe supply, I know much less about safer injection sites, and there are much less confidence about, my opinions there. What I will say is that there is this belief that safer injection sites do reduce harm, but the evidence in support of that seems to be a little bit questionable. And then here's where I'm going to get some background information that I haven't publicly reported yet. So Insight, that's the name of the first safer injection site, which was launched in Vancouver in the early 2000s. Two doctors, Dr. Julio Montaner and Dr. Thomas Kerr, advocated for the creation of that project. And then it was approved. And then the federal government, federal liberals at the time, gave a $1.5 million, I believe, dollar evaluation contract to the BC Center for HIV Excellence. And at that center, that happens to be where Dr. Kerr and, Dr. Montana works. So these two doctors were essentially tasked with evaluating their own project, which was a giant conflict of interest that everyone just ignored. So in the subsequent few years, they produced over 30 evaluations of Insight, all of which were co-authored by Dr. Kerr, and all of which, gave glowing reviews to the project and said that it was wonderful and, it was reducing crime and so on and so forth. Well, there was something suspicious there. So the RCMP ended up commissioning an independent researcher to evaluate these evaluations. The guy's name was Colin Mangum, and he did this, I think, in around 2007. And what he found was that these evaluations routinely misrepresented the impact of Insight, overstating positive outcomes and minimizing harms. And I'm going to give you two specific examples of that. So the evaluations claimed that Insight reduced crime. However, when Mangum spoke with these stakeholders, he found that the opposite was true, that crime seemed to significantly increase, resulting in a need for a significant increase in policing in the area. So I believe 3 police officers approximately were posted 24/7 around Insight, and dozens more were brought into the area, and that reduced crime. But the evaluations claimed that Insight itself reduced crime and, ignored any notes of increased policing. Similarly, Insight claimed to create thousands of referrals to treatment services. When Mangum investigated that, he found out that their definition of a referral was just handing someone a leaflet. And when he contacted nearby treatment facilities, he found that none of them said that they had received any referral from Insight. So, we're looking at gross misrepresentation of data, or at least these allegations. Now, this is what Colin Mangum says. So it's an allegation that hasn't been fully proved yet. I don't want to be sued by these guys by claiming that it's an objective fact, but, it's a pretty serious allegation. So when people say that, safer injection sites work and that we need to keep on investing in them, we have to be mindful of the fact that the evidence base for these interventions is quite questionable.
Right, for sure. Another thing that liberal drug policy supporters claim works is decriminalization, and they'll point to Portugal that decriminalized drugs, and they went from having high overdose rates, high use of heroin, to having some of the lowest in the European Union. When BC decriminalized drugs, that didn't stop it from having the highest cause of death be illegal drug use. So what are the Portuguese doing differently from Canada and British Columbia in particular?
Okay, quick question. Am I allowed to swear?
Sure, I think we might bleep it out, but go ahead.
Okay. So you know what? The Portuguese model has historically done quite well, and what Canada's done is implemented the shittiest possible version of that model. So what Portugal did is that it decriminalized possession and purchase of small personal amounts of drugs. Everything else remained criminalized. So if you sell the drug, it's still criminalized. If you have larger amounts of the drug, it's still criminalized. It's just that, if you get caught with a small amount of cocaine or a small amount of pot, you're not going to be sent to the criminal justice system. Now, what happens instead is that they have something known as dissuasion commissions. And dissuasion commissions are composed of a lawyer, a social worker, and a psychiatrist. And together, they evaluate someone who has been caught with drugs and figure out what to do. And they have punitive powers, such as being able to temporarily block access to welfare, or levy fines, or ban someone from going to certain people or places. And they use these powers to heavily pressure, but not necessarily force someone to go into treatments. And treatment facilities are, widely available and very well funded in Portugal. So what happens essentially is that, you have what you would normally have in society. There's accountability for drug use of all types. It's just that at the lowest level, they have an alternative system that keeps people out of the criminal justice system, doesn't burden them with criminal records that ruin their lives, and tries to divert people to healthcare, to the healthcare system, rather than throwing them in jail. And that all makes sense. Now, what BC has done is they basically said, okay, let's just decriminalize small amounts of drugs, but put in almost no effort into diverting people into healthcare and treatments. So, Portugal has these dissuasion commissions. They have where there's actually, punitive powers that force people into treatment. Whereas in BC, if you're caught with a small amount of drugs, you are just given a pamphlet that, tells you about treatment options, as if you, as a drug user, were not already aware of this. So it's a joke, right? Like it's completely, there is no real attempt to push people towards treatment. We're just letting people do what they want with impunity. And we're seeing the negative impacts of that already.
So do you think that, some of the activists in BC call for destigmatization, and, there's other aspects of society that we've moved to maybe destigmatize, and the one I'm thinking the most of is mental health. We've talked about a good way to have people come out and explain their mental health issues is to have it destigmatized, but they also want to destigmatize drug use. Do you think that it's important for drugs to kind of stay stigmatized? How do we find a balance where people are not ashamed to be open about their addictions while also maintaining a notion in society that, no, you should not be using these drugs?
Well, I want to flag that this is an element of the conversation that I haven't done a substantial amount of research in. So what I'm about to say is based on my personal impressions and is not scientifically backed. So, take it with a grain of salt. But I think that, obviously some level of destigmatization is important for helping people be more open about their drug use and pushing them towards treatment, right? When someone hides their drug use, it's painful for them and it pushes them into risky behavior. Versus when they're able to open up to people around them about the fact that they're doing drugs, it helps them, seek out help and support from their close social contacts. So that's important. There's a certain level of destigmatization which is needed. However, we can't destigmatize too much because, when you have higher barriers to using drugs, people use drugs less. If something costs more, you're going to use it less. And stigma is it's a sort of psychological and social cost, right? Like if you're afraid of the stigma of using a drug, you're not going to use it as easily. And, to illustrate that, let's go back to the comparison between hydromorphone and heroin. Heroin is highly stigmatized amongst youth. Hydromorphone is not. Youth are more likely to use hydromorphone because that stigma is not there. So similarly, we don't want people to think that using hard drugs is fine. It's obviously not. It's going to destroy your life. So we need to find that middle ground where we say, if you're using drugs, you know what? You're not a terrible person. We're here to help you, talk about your problems, but also drugs are bad and please don't do them.
Right, for sure. I think there's often a need for balance in most days. And unfortunately, because things kind of become politicized, there becomes two extremes and no room for nuance. You've criticized a lot safe supply. What would you see as maybe an alternative? Because there's, if you look at Vancouver East Side, even Toronto or Ottawa, there are so many drug addicts on the streets that are, it's almost like they're lost souls. These poor people are completely high and not even maybe conscious that they're living. How do we save these people? How do we get them off the streets, off these drugs, and back in society where they belong?
Well, I want to first of all clarify something. So at the very beginning of our conversation, I had mentioned that there are different models of safer supply. And I'm very much against the model that is in Canada right now because I think that it's grossly irresponsible. However, the addiction physicians who I've spoken with have identified a model where safer supply could be responsible, and it's something that I broadly agree with. So a model of safer supply that I think could work is one where paradoxically stronger drugs are provided. So hydrochloroquine doesn't, help fentanyl users. So let's provide people with safe fentanyl. But let's ensure that consumption is supervised. So we're not just going to give you fentanyl and send you on your way. We'll give you safe fentanyl. You have to consume it while supervised and you stay under supervision. Right. And that prevents you from dying. And rather than using it as an indefinite intervention where we just give you drugs until whenever, we instead think of it as a temporary solution with a very specific deadline that is used to help transition people into more traditional forms of care. So let's say you're about to start using Suboxone or Sublocade and you need some time to transition. I think it would make sense, to provide that patient with a temporary supervised version of safer supply. That model is being somewhat implemented in Alberta. So Alberta is planning to roll out something known as, forget the exact term, heroin-assisted treatment, something like that. It's like essentially providing drug users with stronger opioids as a temporary measure to transition them to care. So, we're seeing that in Alberta. But once again, that model of safer supply is so different from what we're doing in BC right now that it's kind of like the same thing in name only.
Do you think eventually the people in BC are going to realize that maybe they're not doing it right? Or do you think they'll just kind of double down the same way public health leaders have, doubled down on the lockdowns during the pandemics and the masks, even when the science showed otherwise, or double down on the pediatric trans healthcare despite all these detransitioners coming out? Do you think we're seeing a trend here where they're going to keep on doubling down until there's maybe a change in government?
I think so, because the issue has become so political. I think that the federal government will find it almost impossible to let go of this program and admit that something is wrong. And partially that's because the Minister for Mental Health / Associate Health Minister, Carolyn Bennett, is a bit of an ideologue. I've seen her speeches. I've engaged with her. She doesn't seem to be able to critically evaluate study design. And she doesn't always seem like the most astute of thinkers, to put it euphemistically. So I don't think that, she'll be reevaluating her beliefs anytime soon. However, I think that there are some level of changes. In BC, so after my report came out, BC seemed to shift course. So initially they denied that anything was a problem. Now CTV and Global are also reporting, the same stuff that I'm reporting. And we're seeing a shift. So the BC government recently announced they're going to give more funding to opioid agonist treatment, so methadone and Suboxone, which is a recovery-oriented treatment, which is, an alternative to safer supply and has decades of research behind it. So we're seeing a shift towards recovery-oriented care in BC. And from my understanding, I'm aware that some people might be trying to put together lawsuits against the federal governments, people who have been harmed by safer supply. And I think that if these lawsuits do come to the public and, they do percolate and multiply, then that might force the federal government to abandon safer supply unwillingly because the legal and political exposure would be too high. But once again, we need people to file these lawsuits first.
Right, for sure. And hopefully something can be done because, we're talking about people's lives here, and it's so sad how people's lives are getting destroyed by these drugs and these, supplies drugs and whatnot. Adam, thank you so much for coming to speak with me. I really appreciate your insights on this and the work you do to expose the problem with what's going on right now. And I'm sure we'll talk again soon.
Thank you for having me.
I hope that you enjoyed this interview. If you did, Please consider making a donation to True North by visiting donate.tnc.news today, because unlike the legacy media, we do not take the Trudeau government's media bailout package. For True North, I'm Elie Cantin-Nantel. Thanks for watching.